Dr. Henderson, are you happy with the prospect of all NHS staff being compelled to have 2 jabs or being dismissed, as we're reading this morning?
So that's not something that I would be giving anything other than a personal opinion. At the moment,
Sure.
we would like staff to be vaccinated because we know that that will give them protection, and that we've seen during the waves that healthcare workers are very much in the front line of the risks as well as the treatment of the pandemic. So yes, I'm keen that people are getting vaccinated, and that needs to be clear to them, and also, to be honest, getting the booster, because actually that's the next layer, is getting a booster as well. So personally, I would be saying to everybody, think very, very carefully about not doing this, because this puts your health at risk, and therefore then additionally puts your patients at risk. So as a professional view of this would be to get vaccinated.
I ask that because, of course, anything that puts extra pressure on the departments where you and your colleagues work, of course, could tip us over the edge. Do you think that the emergency departments, given the situation as it is now and what we know, are going to be able to cope this winter?
We're already struggling to cope. This is not something that's coming in the next couple of months. We're already in a terrible place where we have got large queues of ambulances with vulnerable people waiting in those ambulances to be offloaded into departments, and other patients at home waiting to be picked up by the ambulance. That's the thing that really worries me, that these are patients who've not yet received treatment, that we don't necessarily know what's wrong with them, that we're really struggling to get into our healthcare facilities to then work out what we need to do. That's the real worry from my point of view, and we're already in that situation.
What do you need to alleviate the problem?
We need to have beds. So the biggest problem is exit block, both from an emergency department into hospital wards and from hospital wards back out into the community. So we need to be able to get all patients who are fit to not be in hospital back out. So the primary thing that we need is to establish enough space in community facilities or enough community support so patients can be in their own homes, so that we don't have patients in hospital who could be being cared for in a different environment. That then works itself back towards the front line, so that instead of patients being stuck in emergency departments, what we call exit block from the emergency department, we can get them out of the department and we can get new patients into our cubicles. It's a whole system problem which happens to be bottlenecked in the emergency department and therefore very visible on the ambulance ramp.
If nothing changes, can you talk to us about the seriousness of this? I mean, is this an inconvenience, or are we seeing people at risk of essentially dying because the system is blocked up?
The system is incredibly busy at the moment, when we're already reaching a point where 999 ambulance call handling is delayed. So you don't get an immediate answer to the phone when you ring 999. It takes time to get an ambulance. That puts patients at risk, because you don't know what's wrong with them. You don't know what is on the end of the phone. Is it a patient who needs care immediately as a blue light ambulance, or is it somebody who can afford to wait 20, 30, 40 minutes before they're reached? But the same is true on the ambulance ramp, unless we can get patients in and actually assess them. So that is risk of real patient harm and patients dying. So it actually really matters. This is not about an inconvenience. This is not about being patient because of a long wait. This is about people who could come to significant harm if we're not getting the care to them that they need, because there's just so many people in the system. You can't spot the needle in the haystack.
One of the issues which seems to have arisen is the question of whether people can go to their GPs or not and get face-to-face consultation. If they can't, they turn up at A&E. Do you think that there is any issue with that? And might you need to say to your GP colleagues that it's time for them to see more people face-to-face, as the Secretary of State seems to be suggesting?
Primary care is under enormous pressure as well, but the patients that we're really worried about in the emergency care system are not patients who are getting or needing necessarily a GP appointment. They're sickest patients. We're most worried about the most vulnerable patients, and those are the patients who are coming in by ambulance by and large, rather than it being an issue with primary care patients. Yes, we get stories of patients who've tried to get in touch with primary care and then maybe have come to us, but that's not the main pressure. The main pressure is people who need admission and not having a bed for them to get to. That's where our problems lie, is in exit block rather than just the volume.
I'm not going to invite you to be overly dramatic, Dr. Henderson, but everything you have told me this morning adds up to one simple statement, that it looks and sounds like and feels like that maybe people who are dying today because of the crisis that you and your members are facing.
We know that crowding is harmful to patients. We were crowded in emergency departments pre-pandemic. You said at the beginning of this, it's winter, another winter crisis. You know, what's new? I mean, sadly, that is true. We didn't go into the pandemic in a great place in emergency care. We didn't have enough beds then. The problem is that things are worse at the moment. So we need everybody to be as careful with the healthcare resources as they possibly can be and try and minimize the need for healthcare resources. So if we've got 8,000 patients in hospital who are suffering COVID, if we didn't have those patients, that would be another 8,000 beds in the system. So every bed that gets filled by a patient with COVID, in a sense, is in a hospital bed with a potentially avoidable disease. And that's what we need people to focus on. If we want to get through the elective backlog, everybody will know somebody who's on that list. We won't be able to do that unless we've got the beds to put those patients in. So if we can get COVID levels down, if we can make sure that the vulnerable don't get infected and then need hospital care, if we can make sure that we don't have people who are severely ill because they catch it when they're unvaccinated, all of that will help. We're all in this together to try and make it better.